Hello everyone, I'm Tamara Paget and I will be presenting case study 67, ovarian cancer. This is for nurse 711, advanced physiology and pathophysiology. WD is a 68-year-old woman who presented to the hospital emergency room 3 months ago with a 3-day history of acute abdominal pain. She has reported a weight gain of approximately 5 pounds during the last 3 months, despite having a loss in appetite. The provider ordered ultrasound and TC scans of the abdomen and pelvis, which did show large non-cystic soft tissue pelvic mass in the left lower quadrant. There were also multiple solid lesions in both kidneys and the liver. A chest x-ray was positive for several masses in the right lower lobe of the lung. Laparoscopic surgery was performed, which revealed masses of the left ovary and iliac nodes. Tumor biopsies from the ovary, kidney, lymph nodes, and liver were positive for epithelial ovarian cancer, which is the most common type of cancer, accounting for 85 to 90% of all ovarian cancers. Blood work showed a serum CA-125 level of 190 units per ml, which is abnormally high. This is a blood test specific for the monitoring and treatment of ovarian cancer. A hysterectomy, lymphoidectomy, and bilateral salpingoectomy were performed. The tubes in the ovaries were removed. She's now been admitted to the special procedure unit for her first cycle of systemic chemotherapy. Ovarian cancer is the 8th cause of cancer in women. This results from an abnormal growth of cells in the ovaries and can invade nearby tissue and distant organs like it has with WD. There are approximately 19,680 new cases of ovarian cancer in 2024 in the United States and almost 13,000 deaths annually. Risk increased if you have a first degree relative that was diagnosed, and there's only a 50% 5-year survival rate. Most mutations are related to ovarian cancer appear to be acquired during a woman's lifetime as opposed to being inherited. Also, most ovarian cancers require several gene mutations before a normal ovarian cell is transformed into a cancerous or malignant cell. Only 1 in 5 ovarian cancers is diagnosed when malignant cells are still confined to the ovaries. When this occurs, the 5-year survival rate is about 93%. However, when the cancer spreads to surrounding organs like the uterus, bladder, or colon, or lymph nodes, the 5-year survival rate is 69%. When distant sites like the liver or lungs are involved, the 5-year survival rate is only 30%. For ovarian cancer to occur, a mutation in the gene that promotes cell division, or oncogenesis, occurs. Then an additional mutation in the tumor suppression gene occurs. This tumor suppressor gene is a gene that slows down cell division, causes abnormal cells to die, and or helps repair DNA damage. When these two mutations occur simultaneously, abnormal cells grow unchecked, more mutations occur, and cells become less like their original genotype and become more and more prolific. These cells can then gain the ability to detach from their original tumor site, move to other places in their body, and build their own blood supply by secreting antigenic factors. You can see in the top picture there, a picture of an ovarian cancer cell. You can also see where the tumors are growing there on the left ovary, and there's several tumors growing on that ovary. And then the bottom picture shows you where common sites of new tumor growth can occur with cervical cancer. And you can see that it can affect multiple different body multiple body organs and systems, which is higher staging of cancer. Unfortunately, because this cancer is so low or asymptomatic, it is often caught very, very late when the cancer has already spread. The cause of these mutations is still unknown, but the BRCA2 mutation does increase the risk of ovarian cancer, but most likely mutations in these genes occur because of acquired exposure, such as asbestos, radiation exposure, or chemical exposures. As I said before, early stages are often asymptomatic or not specific for ovarian cancer and can be confused with other pathologies. This patient has several risk factors. Appears she probably has the BRCA2 gene with several first degree relatives, including her mother, her aunt, her grandmother, all dying from a reproductive cancer. She does smoke 1 pack per day for 9 years. She has no children, which there is increased risk factor for women who began menstruating before the age of 12, had no children, or gave birth to their first child after the age of 30, or experienced menopause after the age of 50. So she has all of those. She started her period at 11, she started menopause at 54, and she has no children. Additionally, she can be at increased risk because she had endometriosis as well. The abdominal pain is the most common presenting symptom of ovarian cancer, which she does present with. Here, her CBC and liver enzymes were normal. She does have an allergy to hydralazine and aspirin. She takes carbamazepine for seizures and amlodipine for hypertension. She has had a benign fundy, which refers to a normal or non-problematic appearance of the fundus of the eye, which would show that there is no evidence of increased intracranial pressure or metastatic spread affecting the eyes of the cancer. Her vital signs are normal except for a slight diastolic hypertension. She's blood pressure of 128/84. And she also presents with some concerning lab values of increased creatinine and BUN, which possibly point to a kidney decrease in kidney function. Her CA-125 is 93, which is still abnormally high, but much lower than her presenting value of 190. Her fasting glucose is also slightly elevated at 106, so that would be something to keep an eye on. The role of the advanced practice nurse would be appropriate diagnosis and treatment, which she has already started. She's had her surgeries, she's being admitted for chemotherapy, and often radiation is not recommended for clients that have such massive spread because it can affect the surrounding blood supply. The advanced practice nurse should help minimize side effects, provide a lot of education, and offer support and recommend support groups. The Christian APRN should offer presence and compassion. If the client would like prayer, offer to pray with or for the patient and share hope without minimizing the feelings and minimizing the severity of the disease process, and also help them explore the meaning and the purpose of their life, of the disease process, and what they are going through. Questions to consider about this patient case is what combination of chemotherapeutic agents is appropriate? Why is a complete neurological exam so important for this patient? And does this patient have a high or low survival rate probability? And here are my references for you to view. I hope you've enjoyed this presentation. Thank you for listening.